So, emergency situations. So, just like us, all of our animals will go into shock when something bad happens. So, shock happens when the organs and tissues don't receive enough blood, and effectively the body goes into a sort of protective mode and into a shutdown. So, shock can be caused by a sudden traumatic incident. So, a sudden traumatic incident we all think is it's going to be horrendous. It's going to be my dog's been hit by a car. You can have the most nervous dog in the world, and actually another dog barked at it. That's a sudden traumatic incident if your dog's not expecting it. So it's understanding the context of it. Pain, a fairly obvious one. If we all suddenly had a really bad injury, we're going to feel pain, we're going to go into shock. Blood loss, sepsis, and rapid fluid loss like burns as well. Again, things that we all understand, kind of shocking animals is the same as shocking us. So again, it's understanding what's normal for your dog. Some of the symptoms of shock are shivering not associated with cold or anxiety. On a warm day like today, something's happened, you've got back from your walk and you sat down and your dog's still shaking. That's not normal. We know that's not normal, our dog's not normally doing that. A depressed level of consciousness. I'm kind of guessing if we've got to that level, most of you will have the dog or the cat in the car anyway on the way to the vets. Decreased body temperature, muscle weakness, the dog or cat can't stand. The increased breathing rate. So that breathing rate we looked at earlier comes straight back into this. So understanding what's my normal respiration rate. I take my dog for a walk in the morning, we come back, half an hour, what's his respiration rate? Okay, we've taken out for a walk this morning, something's happened, come back, the respiration rate is still really high, or it's gone the other way. A weak and rapid pulse. So if anything does happen to your dog, one of the things the vets may well ask when they're on the way in is sort of, can you ever feel for a pulse? So what we're looking for with the pulse is we can feel for the heart rate, and we're going to show you how to do all these things at the end anyway. So you can feel for a heart rate, but we want to make sure the pulse is doing exactly the same. Because if we've got a really strong heartbeat, but we've got a really weak pulse, the blood's not getting round to where it needs to give us that pulse. So again, is it more of an emergency than we would expect? And then pale gums. So again, we'll show you later sort of how to have a quick check of the gums, also how to open their mouth safely. There's an awful lot of people don't realise there's a really nice, easy way of opening a dog's mouth so it can't bite you quite so easily. So again, we'll go through those things, but that's the sort of things you're looking for. So again, you guys understanding what's normal is the key. The lovely thing with shock is the treatment is actually really simple in the early stages. Keep the animal calm. Keep yourselves as calm as possible. Prevent heat loss. So on a really cold day, we do want to make sure we've got a blanket in the car. So as I said earlier, none of these things normally happen at home. So it's making sure we go prepared. And we've always got a spare coat, or we've got our coat on, but there's nothing worse than having to take that off to put on the dog. We're not going to do it, but we will kind of do that. So preventing heat loss. We don't want our dog to kind of lose any heat. But in the flip side, when we'll touch on a few things later, we don't want it to overheat either. Withhold any food or water and take the animal to the vets immediately. Traffic accidents. I'm a bad person when it comes to this. What is the worst cause of road traffic accidents for our dogs and cats? On leads. Yeah. Exactly. Now I'm very lucky, I've got a spaniel who is very well trained. He walks about there. If I stop, he stops. But again, I do understand there's a lawful thing. So understanding how they are around traffic. So my dog is actually pretty good, but again, if you've got a dog that's not, making sure that you're never letting it off the lead. Thinking about things like keeping the pet on the lead. How do you go out in the mornings when you go for a walk? If you live in town, if you live on a busy street, understanding is the gate shut at the end of the end of the path? Do we put the lead on before we leave the house? All of those sorts of things. Keep animals safe during transport. Does everybody know that you are supposed to have your dog secure in the car? Either with a lead on the front seat or on the seat, or in the boot with a guard so it can't come forward. So this was the result of a car accident. That's where the dog hit the window on that side of the window. So just something to be aware of. He survived. The good news is, and he now wears his lead all the time, so he will never be doing that again. But yeah, it's just something to be aware of. Road traffic accidents, don't panic. Stay road safe yourself. Like I've talked about before, we will get emotional. We will run into the road to try and protect our dogs. Restrain the animal as quickly as possible, and take it to the vet, even if they don't seem injured. Dogs and cats can be really resilient. You'll know your pet's far better than us. You might have the dog like mine who the slightest little bit of grass that touches his leg, he's limping. But then you'll also have one that never shows any pain, never shows any fear. Cats especially are really good at hiding sort of pain. So even if you don't think it's been involved in any injuries, do bring it in. Obviously monitor it for shock like we touched on, but just making sure, okay, I'm pretty sure you got clipped by that car, you look okay, but I want to get you checked out. And it may well be that it was just a glancing blow, but actually it could be that a little bit of pain relief or something will help. But again, we can't see, and that's where the vet's job is. So the most important thing to be aware of is distressed and injured animals will express non-typical behaviours. So we want to speak quietly and reassuringly, we want to move slowly, and we want to stay in view of your pet. So effectively, your pet will respond differently if it's been involved in some sort of major accident or major incident. So if it's in pain and that sort of stuff. If it's a dog or a cat you don't know, you have to treat it like it's the feralest thing in the world and it wants to kill you. It wanted to kill you before it was in pain, and now it definitely really wants to kill you. So we do have to think about how we approach our animals. Now, I apologise to the cat owners. I'm not a cat person. That's not me. I'm not going anywhere near that cat ever. Just never. How are you going to get that cat? We think that cat's been involved in a fight, it's got a wound on the other side. How are we going to get that cat from that park down here to these guys?
Blankets.
We do need to try and get some sort of loop or lead or some sort of hold over those animals. So a non-aggressive animal, like I said, is the only one. That's our own animal. That's not something we've never met before. That's our own animal. Approach from the front, gently and firmly tell the animal to stay. Do not treat to any injuries unless life-threatening until you've got it restrained, and then attend to any injuries. If it's an aggressive animal, very similar, but approach slowly, speaking gently from the front and gently reassure, but keeping yourself safe. And then keep the animal safe. So keeping the animal safe is actually the kind of final thing. It's looking after ourselves as a kid. So our restraining methods, I love this. Like I said, we've caught the cat, we've got it somewhere on the blanket and we're holding on top of it. Now this cat, it might not like us, but at this point it can't hurt us. So we've caught the cat, we've got it in a blanket, we've wrapped it up. We now want to keep that cat exactly like that, because the worst thing we can do is try and stuff that cat in a cat box or any sort of box. So the best thing we can do is actually hold it, and holding it away from ourselves so that actually the mouth is kind of facing away. Because then when you turn up here, none of these guys have got to try and fight that cat back out of the box. You can hand it over and you can say, then it's got a cut on its left shoulder, we can see the blood, I've been holding the towel against the pet while we've been in transit. Brilliant. These guys know what they're dealing with. So really, really well. For dogs, just a loop lead, a lead restraint. Moving injured animals. So lifting injured animals is really, really difficult. So if we asked you to pick up Max, because you would do, because that's what we all would do, but it's doing it in a way that doesn't cause any further injury and damage.
Or doing your own back in.
Or doing your own back in, yeah. So what would Max weigh, 25 kilos? 30. So it's a fair lump to pick up and carry. So yes, if you can do it, but it's only if there's no sort of back or hip or spinal issues that you've got going on. So if there was a cut and you were just trying to stop him from exerting too much pressure, absolutely fine. But how we carry them is really important. How else could we carry our dogs especially?
In a
Towel, yeah?
towel. 2 of you.
2 of you? Something like that?
Yeah.
The only problem with that is it's not quite taut. So we actually want it more to be a flat, stretchery type thing. Anyone think of anything we might have in our cars?
The thing at the back of this
Shelf.
Parcel shelf.
parcel shelf.
Yeah,
as
all
well.
those old cars that used to have a proper old school parcel shelf.
Yeah.
Perfect.
Yeah.
Perfect stretcher for your dog. But how many of us take them out because we want the dog to have all the air in the room in the back of the car? Even the really taut ones, now you've got the pull-out ones, they're really good because the material is really taut. So again, rather than thinking how am I going to carry my dog, using something like that is really important. But again, the whole point with only wanting to carry the dog is to stop it moving. So if the dog's cut itself but it seems absolutely fine in itself, don't worry about carrying it. Do you know what I mean? If we can stop the bleeding there on the scene with the first aid kit that you've all remembered to take with you, absolutely fine. But if we're not, and we do need to carry it, sort of finding something. Also making sure you're not trying to do it on your own. Because I guarantee if you've taken Max on a 1.5 mile walk and he cuts himself at the far end, 30 kilos to walk back is going to take some doing. So making sure that kind of, have we phoned ahead? Can we get someone to come and meet us? Thinking about the whole situation rather than, right, I need to get back to my car to do this. Actually, is there a way that we can be more productive or more actually get what we need to do? Controlling bleeding, it's really simple. It's exactly what we do with ourselves. So pressure on and around the area affected, which will compress the blood vessels which are open, restricting the blood flow through them. Would anybody apply a tourniquet to their pet? Does everyone know what a tourniquet is? A tourniquet is one of these things where you use some sort of material to limit the blood flow to the end of that or to the wound. Would anybody want to apply a tourniquet?
Only in extremes.
Yeah, really, absolutely spot on. So yes, you can. but it should only be a temporary measure and only when absolutely necessary. If you are 5 minutes away from the practice and you've rung them to say you're coming in, a tourniquet is probably not going to be necessary. If you've got a tiny little bit of blood dripping down there, absolutely fine. If you've got spurting blood and you are probably 20 minutes, 30 minutes away from the vets, then definitely. But it's the thing to say, look, do I need to put a tourniquet on? Speak to the vet when you've rung up to say, this is what's happened, dog's cut itself on some barbed wire, there's lots of blood, shall I apply a tourniquet? Yes. What's the deal with a tourniquet? Apply it for 15 minutes and then loosen it for at least a minute on your way in to do it. So don't feel you have to remember everything. The key is, it's ringing the vets to say this has happened, and actually saying, look, is there anything I should be doing on the way in? Yep, put some pressure on that wound. Yep, put a tourniquet on if you need to. But again, if it's not spurting blood, we don't need to go down the route of doing those. If you find blood, keep calm. Keep the animal as still as possible. It's really important. I know it's really difficult. Max is being brilliant. There's an awful lot of people whose dogs would never ever sit down, even if they were sort of the leg was falling off. They're still going to be trying to run around and do things. Control the bleeding and then transport the animal to the vet. Even the smallest wound, as we'll see in a minute, can turn really, really bad if we don't get it treated and cleaned properly. So it's understanding that and making sure that kind of what's caused that. Was it something nice and clean? Unlikely. Was it something that actually needs to be washed and treated and done properly? Yes, definitely. So bandaging. Bandaging for us mere mortals at this end of the room, is an interim measure before we bring our pet to the vets to get it done properly. If you do feel the need to put a bandage on, I think bandaging for us is, I don't want my dog to bleed all over my car, or my carpet, or my sofa, so I'm going to put a bandage on to stop it, and then I'll get the vets to do it properly. So don't leave any self-applied bandage on for longer than is necessary. It will look like this, won't it, Lennon, when you do one in a little bit? So that's what it looks like when the vets do it. So really nice, proper. They will have cleaned the wound, they will have done everything they need to do, various different layers. We're not going to show you how to do that, we're going to show you how to do the very basics of what you would need to do. Suspected broken bones, we will get squeamish, we will get emotional when these happen. The key is to just keep our animal as still as possible. It's not thinking about anything other than trying to keep whatever limb is damaged or is broken as loose and as kind of supported as we possibly can. Not trying to move things back, not trying to kind of hold things where we wouldn't do, just keep them as confined and as quickly as we can. If there is bone visible and you can see it through the wound, sort of simple tea towel, just something over the top of it, just to stop anything else getting in there is the key. Please don't feel the need to apply a splint or a bandage, and please don't wash the wound yourself. So apart from a fight wound, which we're going to touch on in a minute, there is no other wound that you guys need to think about washing before you come to the vets. Everything else, leave it alone, bring it down to the vets, they will wash it and clean it properly. So I think broken bones is probably one of the most horrible things we'll probably see. It's a nasty, horrible thing. There will be blood, there'll be skin, there'll be everything. So it's just one of those things, I think, damp tea towel over the top, holding the whatever limb it is in place as free to keep it supported as we can, and then bring it into the vets as quickly as possible. The exception is our fight wounds. So fight wounds with dogs and cats, the true extent of the penetrating wounds is often hidden. Always take an injured animal to the vets because shock is going to happen. It's painful, it's been a traumatic incident, and they will have lots and lots of wounds that need to be treated. This is the difference. Your dog or your cat has probably not been bitten by a nice dog that's had its teeth cleaned that morning, or a cat that's had its teeth regularly cleaned. So clean the area as soon as possible. So if you're going to add anything else into your sort of first aid kits, a simple saline wash is absolutely perfect. Just a little bottle of the saline wash, absolutely brilliant. Clean it out because we're going to flush more out than we are in. The problem is if it's just a normal wound, the way we would do it, we're probably going to make it worse. We're going to put more bacteria in. If there's bleeding, control this prior to transport. If there's a skin flap present, try and keep it moist. Try and get it back in position, and then if you want to bandage it, you can do, but probably the best thing to do is just hold it in place. And again, if you're sort of seeing lots of this, we want to get it to the vets as soon as possible. Fight wounds, so this is one, I can't remember what the breed was, that skin flap, as you can see here, we want to try and get that back over the wound as much as possible before we're bringing it in. So it just allows the blood flow through the skin flap as much as possible, so that we're actually kind of, when the vets are then looking at it, they can stitch it all back together.
We call it a vet wrap, but basically it's a self-adhesive bandage. It sticks on itself. Okay? So one advantage is that you do not need another bandage to try to hold it in place because it sticks on itself. One disadvantage is very, very rubbery. Okay? So if you make it very tight, it is going to be like a tourniquet. So do not make it very tight, and I'm sure how to sort of check the tightness in a bit. Okay? So let's, for example, okay, and places where you can actually put a bandage on a dog is very, very limited. Anywhere along, you need something to wrap. Okay, so it's like the shoulder, there's almost no way you can put a bandage on there. You can probably just hold it in place, unless you wrap it all around here. It's not going to stay over there. Okay, so usually places where a cut is anywhere along the leg. Okay, that's where we show you. The principles apply to the tail. For the ear, I'm not too concerned because it's highly unlikely you're able to bandage the ear. Okay, so it is more of holding it in place, and if you want to, around the head. But same again, not too tight. Yep. Okay.
If you do feel the need to ever put a bandage over your dog's ear, mark where the ear is, so when they're taking the bandage off, they know where the ear is.
Yeah. So some people, if you put like this, they actually draw the shape of the ear on the bandage. Yep. So if you have to do that. In reality, you can use almost anything. Okay. I'll go as far as using kitchen roll. Yeah. Just fold it into the shape. Pop it over there. It's not going to be there forever. You just literally remember, wrap it, come down to the vet. So maybe 15 minutes, 10 minutes less, half an hour, maybe, so to speak. But it's not going to be there forever. It is not a proper bandage for you to go overnight. Okay, this is just emergency. Okay, so with these guys over here, you can cut it to the shape that you want, just using a pair of scissors without opening it, so you can save the rest. You see what I mean? Okay, and these guys, they usually have got one silver side and one non-silver side. So just put the silver side on the wound area. So example, our little friend has got a cut over here. Okay. So you put the bandage, you put the whatever you're going to use over the cut, okay? It goes both ends, okay? So try to keep one end to the other, okay? Because this is thicker one side than the other side. So when you wrap it around, see how I'm stretching it, okay? But I'm relaxing it before going around. What I'm not doing is stretch it and going around as tight as possible because that will act as a tourniquet. So do you see the difference with me doing this? I end up using this much of bandage. If I relax, I end up using. There's a huge difference. Okay, there's a difference in gap over here. Whereas if I do it too tight, then there will be no gap. Then there's a tourniquet. Problem with tourniquet is that, so to be even more scientific about it, arteries from the blood pump blood here. Veins go back. Arteries has got blood pressure from the heart. Veins is passive movement. If I put a tourniquet like this, the artery can still pump blood inside there, but the vein is occluded. So you get a swollen foot. All the blood keep going inside here, but not coming back. So just now when Paul was talking about 15 minutes, then after that 1 minute to relax, that's what the 1 minute is for. Just in case you tie too tight, it's for the blood to go back there. Okay? Long and short of it, if you tie, you see a swollen foot, you tie too tight. What to do next? Open up again. Let the whole dog sort itself out. You can massage the leg a little bit, but that is a sign that you're tight too tight. Does it make sense? Okay? So this is very useful, self-adhesive, as you can see. I'm not doing anything, and it sticks to itself. Okay? It's also terrible. That's it. Okay? Areas that you can tie is anywhere along here. Okay? Maybe after the elbow. Once you go to here, it gets more tricky because it's fat over here, thin over here, just slip off. Okay, so this all this you can do over here. Maybe the head around, okay, but same again, do not make it too tight because you will suffocate your dog. Alright? Back leg as well, you can do it all the way up to the knee. Highly unlikely for you to go above the knee, the thigh is too wide for you to use this. Okay? If a cut over here on the side, you can do a belly wrap all the way around. So that it's highly unlikely for you to do too tight that way. Okay, for smaller dogs, you may stop the chest from expanding, causing breathing issues. Yep. So those are the sort of common areas that you can sort of.
I think the key with the bandaging is, if you don't need to do it, don't do it.
Yeah, exactly.
If there's two of you and one of you can hold a tea towel or whatever against it, and there's not that much blood, don't waste your time in spending time trying to do it.
Yeah.
The other thing I would say is do practice. Do go home and practice either on yourself or your dog or whatever, just so that if it does happen, you know what you're doing. Because again, it's one of those things that, like Max is perfect. because he's just fallen down and decided this is my life today. I'm here, I'm going to let. But actually, if you do have a really wriggly dog, you will soon quite realise that actually there's going to take more than 2 of us to do this. Actually, why am I even worrying? So again, understanding what's normal on there.
If you hold the bottom, it bites from the top, that's where you get hurt. So i.e. when you hold the top must be firm, the bottom I'm not too concerned. Okay? So how do I open a dog's mouth? I'm going to give little tablets. Just behind the canines, I know little sweetie, there's a little natural gap. For me, usually, because I'm holding on to the top, I know our little friend cannot bite from the bottom. So literally, you cannot bite me from the bottom. This is not going to cause any action. Okay? It's this. Then my fingers will get damaged. Understand? So usually when I open a dog's mouth, like this is a classic, amazing, beautiful example. So don't expect all dogs to be like this. Yeah? So we're all head turning around, flicking around, snarling. Once you do that, don't bother to get bitten. Okay? So open a dog's mouth, take a look inside there, and if needed, I'll put a tablet inside there. Same again, I can put my hair inside there without a problem because I got an upper jaw. That is not an issue. Okay? Once I release the upper jaw, I get bitten. Okay? So it's the upper jaw that bites, not the lower jaw.